Hi, I'm Congresswoman Judy Biggert. Here in Washington, Congress is debating legislation that we're told will reform our nation's health care system. Like many of you, I believe that health care in America is in crisis. I also believe, as many of you do, that health care costs are out of control. These costs are affecting every family and every business in America. Too often, people are forced to weigh their wellness versus their wallets when considering a trip to the doctor's office. Democrats in Congress have a plan to deal with health care, but like every Democrat plan, it involves an expansion of government, the creation of a new bureaucracy, and the introduction of a whole slew of new mandates and regulations. Spend, spend, spend. And how will they pay for it? By raising taxes, of course. New taxes on small businesses in the midst of a recession, and even new taxes on those who can't afford to pay for health care on their own. Think about it. Just think about it for a minute. A tax to pay for health care on those who can't afford it. Does that make sense to you? But in addition to these ridiculous taxes, the Democrats' health care scheme would also force employers, even small businesses, to provide the specific health care services dictated by government bureaucrats. And if businesses can't afford to provide these services, they'll be subject to even more taxes. Again, we're in the middle of a recession. In Illinois, the unemployment rate is above 10%. Small businesses are struggling to make ends meet and to stay in business. Independent analyses suggest that these mandates will kill over 1 million small business jobs over the next 5 years. So once they've raised your taxes, how exactly will the Democrats' health care scheme cut costs? By underpaying doctors and other medical professionals, like Medicare does right now, by implementing comparative effectiveness research, which has been used in other countries such as Canada and Great Britain to deny treatment, including surgical procedures and medicine, to sick patients. Let me say that again. The way this plan tackles cost is to deny surgery and medicine to sick Americans. I don't think any of this makes sense, and instead of fixing health care, I fear it will only make things worse. Instead, I'm supporting common sense solutions that will actually reduce health care costs and make it more affordable for everyone. Among other things, I've been an advocate for small business health plans, medical malpractice reform, better integration of health information technology, and cracking down on waste, fraud, and abuse. In fact, I introduced H.R. 27, the Medicare Fraud Prevention and Enforcement Act of 2009, which would save taxpayers billions of dollars. And just this week, I signed on to support a bill that would permit chronically ill individuals overwhelmed by drug costs and receiving Medicaid to stay on Medicaid even if their income increases. This bill will give these individuals the ability to get a job and contribute to society without losing their health care coverage and in spite of their illness. Cutting costs and making health care more affordable is critical, and I believe we should do so through common sense measures instead of taxes and bureaucracy. Thanks for watching. I'll be back again as the health care debate progresses.